this episode of the Twin Sister Docs podcast. Thank you to all of our returning listeners and viewers, and thank you to any new listeners and viewers. I am Dr. Elena McDonald, board-certified general pediatrician, and I am Dr. Delana Wardlaw, board-certified family medicine physician. And together, we are the Twin Sister Docs. Today, we're going to discuss diabetes. Dr. Wardlaw, let's get started. What is diabetes? So diabetes is a condition where your body cannot manage the sugar that you take in through eating and drinking. And what happens is it could either be due to, we have an organ in our abdomen called the pancreas, and that produces insulin. So sometimes it could be because the pancreas isn't producing enough insulin, or it could be that your body is not responding to the insulin, or what we call insulin resistance. So many people are affected by diabetes in the United States, about 37 million. That's a lot of folks. Have children and adults are affected by diabetes. And it's something that, one, we can make some changes in our life that we can prevent. But unfortunately, there are some people who develop it, so we have to learn how to manage it.
Yes. So there are two types of diabetes.
Yes.
Right. So let's clarify type 1 versus type 2 diabetes.
Yes. So type 1 diabetes is when it's actually what we call an autoimmune condition where your body produces an immune response where it, attacks the cells, and the cells can't work appropriately to produce insulin.
And
right?
those cells in the pancreas.
And the pancreas, to produce insulin from the pancreas, right? And so those are type 1 diabetics, and they typically need insulin. And many times it can occur at a younger age, but you can develop at any age. But we do see it. Children have type 1 diabetes, young adults have type 1 diabetes, but it can happen at any age. And then you have type 2 diabetes. And so type 2 diabetes is by far the most common diabetes. And type 2 diabetes is when your body is not responding to the signals that the insulin is providing. And so really with diabetes is our body needs a signal to take the sugar from your bloodstream to your cells, which utilizes sugar for energy.
Yes.
And insulin is what provides that signal.
And if there's not enough insulin or your body's not responding to the insulin, then when you eat your food, the sugar does not move from the blood into the cells.
Yes. When you eat your food or when you drink, yes, the sugar, because you can't forget the liquid.
Yes. So when you eat or when you drink, your body naturally, when all systems are a go, you're producing enough insulin and your body's responding to the insulin that's being produced.
Yes.
Then you eat your food or you drink a certain liquid, the sugar that's in that food is in the blood. It's moved from the blood into the cells.
Yes.
So that it can, so that the body can process the sugar properly.
Yes. And use it as energy. And so, and that's where the defect comes in, or that's where the deficiency comes in. And so there are different types of diabetes. We already talked about type 1 and we talked about type 2. There's also gestational diabetes, where diabetes that develops during pregnancy. And sometimes the diabetes will go away after the pregnancy, but sometimes it can persist too. And it can also put you at higher risk for developing diabetes later on. You also have diabetes. Well, let's talk about pre-diabetes.
Yes. So please explain the difference between diabetes and pre-diabetes.
So pre-diabetes is the precursor to diabetes. And yes, it is a diagnosis. And pre-diabetes is where your sugars are elevated on occasion, but they're not elevated at a significant level. And you're not classified as diabetic. But we know that having pre-diabetes actually puts you at risk for developing diabetes. So then we want to try to prevent that from happening. And exercise and diet are key and to helping to prevent pre-diabetes from moving on to diabetes.
So how do we diagnose pre-diabetes, Dr. Wardlaw?
It's a blood test. And so we do the blood test called the A1C. And the A1C, if it's between 5.7 and 6.4, that is classified as
pre-diabetes.
Yes. And
The A1C is a test that looks at sugars over about a 90-day period. So it's
3 months.
yeah, so it gives us a better picture as opposed to just that
One-time glucose.
glucose that you'll get in the office or the one-time glucose that you get, when you're sticking yourself at home. So you have gestational diabetes. And then you'll hear this term that we hear, well, we used to hear it a lot. I don't hear it as much anymore. My practice, a brittle diabetic.
I've never heard that term before.
Yeah,
Dr.
so-
Wardlaw.
yes.
So please educate me.
Yes. So a brittle diabetic is usually a type 1 diabetic who is having severe elevations of blood sugar, causing them to have frequent hospitalizations, and their sugars are not not well controlled. But I don't hear that term as much anymore. Okay.
All right. Now, let's go back to the hemoglobin A1C, which can be used to diagnose someone with diabetes and prediabetes. So if you're pre-diabetic, you already mentioned we can reverse that.
Yes.
We can reverse that with changing our diet. And again, when we say diet, we're talking about your overall nutrition
Yes.
and increase your physical activity.
Yes.
So it is reversible.
It is.
It is reversible, but it doesn't reverse on its own.
Yeah. You have to make the changes.
You have to make some
You gotta make
changes
the
in your life.
adjustments, yes. You have to
in
make the
your life
adjustments.
to reverse prediabetes so that it doesn't develop into diabetes.
There are also medications that can induce diabetes. Steroids is one that can cause diabetes to develop if you're taking steroids over an extended period of time. And so unfortunately, there are some conditions where we have to give chronic steroids, and people have to take steroids for long periods of time. And unfortunately, that does increase one's risk for developing diabetes. Some HIV medications could do the same. And so what that means is that your doctor just has to be monitoring to make sure that that isn't occurring. And if it does occur, to make sure that it's treated appropriately.
So that's the case of while you're trying to correct one problem, we create another problem. And we have to be aware of that so we can monitor it and address it accordingly. Because as Dr. Wardlaw said, sometimes you need that chronic steroid to treat your initial underlying condition.
Yeah.
And then if you subsequently develop diabetes, then that has to be managed also.
Yes.
So, Dr. Wardlaw, what are the symptoms of diabetes?
So symptoms of diabetes could be excessive thirst. You feel like you're drinking, but you just can't quench your thirst. Excessive urination. You feel like you're running back and forth to the bathroom. You're up all night going to the bathroom. You are not drinking excessively. But increased urination. Unexplained weight loss. Weight loss that patients come to the office and they've lost 30 pounds unexpectedly. Diabetes is always on our list of, could this be contributing? And then there are other things as well. Excessive fatigue, changes in your vision. Sometimes if the sugars get really high, you can have nausea, you can have vomiting. So you can have numbness and tingling in your hands, in your feet. So there are a variety of symptoms that can present to make the physician think, yeah, this could be diabetes. It has to be evaluated, yes.
And those are the same symptoms that we also see in pediatrics. So oftentimes, again, Dr. McDonald, she's drinking all the time. Not only is she drinking all the time, she's eating all the time. Her appetite is going through the roof, but she has lost a lot of weight. My child never wet the bed. Now they're wetting the bed. That is a red flag to me all the time when a child who never had issues with wetting the bed has started to wet the bed, need to rule out diabetes.
Another sign is yeast infections. People coming in and complaining of frequent yeast infections because the yeast thrives off of the sugar. And then the other thing is sometimes you can notice skin changes. Like, this darkish discoloration of your skin. Yes, that could be a sign of diabetes. Yes.
Now, not only could it be a sign of diabetes, but it could also be a sign of an increased risk of developing diabetes or becoming pre-diabetic.
Yes.
Because I too see that darkening of the skin. And oftentimes we see it in the neck area. You can see it under your arm, in your armpits. Sometimes you can see it right in your chest, under your breast area. And the medical term for that is called acanthosis nigricans.
Yes.
And I see that in a lot of my patients who don't have diabetes, but we check the A1C. Sometimes A1C is still normal, but we know that that acanthosis nigricans has been associated with developing diabetes later on. Doesn't mean that you will definitely develop it, but it's an increased risk. So when I see that, one, I point out to the parents, let's talk about the color on their neck. Have you sent them upstairs multiple times to clean their neck off? And have you tried to clean their neck off?
Yes.
And no matter what you do, that color is still there. No, it's not dirt. This is a skin color change that we see in individuals who are at increased risk for developing diabetes, who have diabetes. So when I see that in my patients, one, I am going to check the A1C because as Dr. Wardall said, it tells me what the glucose has been doing for the last 3 months. But I'm also going to revisit and re-emphasize the importance of healthy nutrition and physical activity.
Other symptoms that can develop, if patients are having excessive nausea and vomiting, you may hear about this fruity smell that someone can have on their breath. That could be, changes in their mental status. That could be a sign that a patient's blood sugars have gotten so extremely high that they have gone into something called DKA,
diabetic ketoacidosis.
Diabetic ketoacidosis. And what is occurring there is that because the sugar is staying in the blood and not being utilized by the cells need energy from somewhere. So it starts to break down fat to use to get energy. And when you break down too much of the fat, then your body produces ketones, and then you go to this severely ketotic state.
Right. And you can also end up in a coma.
Yes.
And you could die.
Yes.
Once your body gets to that severe state.
Yes.
So the goal is that we don't want you to get to that state.
Yes.
So we need to be aware of these symptoms. And as always, if you notice anything that's going on with your child or yourself or a family member, it's not up to you to figure out what the diagnosis is, but you do want to bring it to your physician's attention so that you can be properly worked out.
Yes. Now, the other thing I want to talk about is the risk factors.
Yes. Let's talk about the good old risk factors that can lead to diabetes, Dr. Wardlaw.
Obesity, a huge risk factor for diabetes because the fatty cells in our body, or what we call adipose tissue,
Yes, adipose tissue.
those increase resistance to insulin, meaning that it makes the cells not listen to insulin the way it should, and then it doesn't respond, and then the sugars remain elevated because insulin's job is to lower the blood sugars. Also, not being active, what we call a sedentary lifestyle, not getting up, doing physical activity, that can also lead to increased risk for diabetes. A family history that could put you at increased risk for diabetes.
As Dr. Wardlaw and I say pretty much on every podcast, we need to discuss our family history. Certain things that go on in the house does not need to stay in that house. We need to know our family histories because it can certainly impact our history.
And gestational diabetes, but we talked about diabetes that develops during pregnancy. So those are some of the risk factors that can put you at risk for diabetes. And of course, monitoring your diet. Now, will you develop diabetes by eating increased levels of sugar? That's a question that always comes about. Well, it's not that you'll develop that means that you will exactly develop diabetes, but that increased sugar will lead to obesity, which we know has a direct correlation to or direct link to developing diabetes.
So you're not going to get the diabetes from eating a bunch of candy and eating a bunch of cakes and drinking a bunch of sugary drinks. But that type of nutrition will lead to obesity, which will increase your risk of developing diabetes.
Yes, it's a cascade effect.
Yes.
It's a cascade effect. And then, so we already talked about what it is, the risk factors, signs and symptoms that you may develop that say, well, you need to get to the doctor so your doctor can have you evaluated. How is diabetes
Managed.
Well, one, how is it managed? How is it tested, right? So we could test for diabetes in a variety of ways. We could do finger sticks when you go into the office, and that just gives us a
One-time.
yes.
It's a timestamp of what your blood sugar is doing at that particular time.
Yeah, and so you could do it as a random blood sugar, meaning you walk into the office, and no matter if you've eaten, if you haven't eaten, it's just a random blood sugar. You came to the office for your 2:00 appointment. We check your finger stick and what is your glucose level. And typically those glucose levels should run less than 180, all right? But then a lot of times we say to our patients, hey, we want you to come and we want you to be on a fasting stomach. Don't have anything to eat or drink except water after midnight or for 8 hours, depending upon what your schedule is. Yes. And then when you come in, so we check a fasting blood sugar. And the fasting blood sugar typically should be, the golden number is around 126, 125, 126. And then we talked about the A1C. And so diabetics are classified if they have an A1C that is 6.5 and above. And the goal is for diabetics to be managed and controlled. And you'll hear that number, my A1C should be less than 7.0, my A1. And so that's where that number comes from.
So question for you, Dr. Wardlaw. So if your hemoglobin A1C is 6.5, are you typically seeing symptoms if your hemoglobin is 6.5, or you may not see symptoms?
You may not see symptoms. You may not see symptoms at a hemoglobin of 6.5. You may not see symptoms at a hemoglobin of 7.0. And so that's why it is key to have to go to your doctor's office and have these things checked, because it may not come along with symptoms. But if you have elevated blood sugar, then that should be a key to get an A1C check.
Right. So again, to drive the point home, get your routine visits, and your doctors will check the blood work when it's indicated to assess your risk of diabetes, or if you're pre-diabetic. Because the goal is, if we're seeing symptoms, that means that the sugars are way too high, right? So we want to try to control those sugars before they even get to that point.
Yes. And another quick and easy way we can check for diabetes, check the urine.
Check the urine.
Yep, because urine, we can see sugar in the urine, we can see glucose in the urine. We can also see ketones. Yes. We can also see ketones in the urine.
So we see glucose and ketones in the urine. To us, that means that you have diabetes, and you need to be further evaluated and treated.
Yes.
Now, you can simply just have ketones in your urine, and we see that if you haven't eaten.
Yes.
Right? So glucose and ketones is what concerns us.
Yes. Or significantly elevated glucose in the urine as well. If you have a glucose of 1,000 plus, then
that's a concern also.
That's a concern as well.
But just ketones alone?
No.
Probably meant that you haven't eaten.
Yes.
And then one other question about the testing and the diagnosis, pre-diabetics. And you just alluded to this, or you just said this, but you can be pre-diabetic and have no idea that you're pre-diabetic. And that's where the A1C is so important.
Yes. Yep. And again, if you go in and you get your regular routine evaluation, and your doctor checks a lab test and your sugars are being elevated, yep, that A1C is the next step to say, hey, could this be diabetes? Could it be pre-diabetes? So see where we are, okay? Or was it just because you ate 5 minutes before you came into the office? Yes. And so that allows us to do that, okay? And then if you're diagnosed with diabetes, is a big diagnosis, because it can lead to complications if it's not well controlled. Right. And so when it's not well controlled, diabetes can affect many organ symptoms. If we do not control diabetes, it will control us. I'll say it again. If we don't control diabetes, it will control us. It can affect your vision. You may hear terms like diabetic retinopathy. That's why diabetics have to get their eyes checked every year. 2, it can cause kidney damage. Diabetes is a common reason why people's kidneys start to run into trouble or fail, or why they end up on dialysis. It can also increase your risk for heart attack and stroke. It can also cause sexual dysfunction. Yeah. It can also cause disruption to your nerves, which can lead to foot ulcers on different areas of your body. It can lead to toe amputations, foot amputations, leg amputations. So diabetes can be very, very challenging. It can be very unforgiving. So you absolutely have to be in tune with your physician so that you're getting regular checkups, you're being monitored regularly. Also, you are doing what you can at home, modifying your diet, Now, once you get diabetes, yes, you absolutely have to monitor the amount of sugar that you're having in your diet. We should be monitoring sugar in any way. We always say you always want to limit your sugar. We should be limited in any way, but you absolutely have to be very mindful. You need to be reading labels so you can see how much sugar content. The drinks as well, the sugary drinks are an absolute, have a major impact on your blood sugars. And so exercise is key. Exercise helps to drive that sugar from the bloodstream into the cell. So that's why exercise is very effective. And it also helps you to lose weight too.
So Dr. Wardlaw says, once you have been diagnosed with diabetes, yes, it can be a bit overwhelming, but you want to work with your physician to make sure, because there are great treatments for diabetes. There is no cure, correct, for diabetes?
Well, diabetes can be reversed.
It can be reversed.
Yes.
Okay.
Diabetes can be reversed, if you are getting regular routine follow-up, you're modifying your diet, if you're getting exercise, if you're taking the medications as directed. You don't have to be on diabetes medications forever.
So let's clarify. Type 1 diabetes, can you cure type 1 diabetes?
Good question. So type 1 diabetes is autoimmune. So we typically can't cure type 1 diabetes, but type 2, where you have that insulin resistance, we just have to retrain the body, lose the weight,
And change your eating habits, take your medications, and you can reverse type 2 diabetes.
Yes.
Okay.
can do that.
Okay.
And then the other one is the genetic version of the diabetes. Those things are not typically reversed as with the type 2 diabetes.
Okay. So we say genetic version of the diabetes. So about type 1.
Well, so type 1 is autoimmune, but there's a genetic version called MODY.
Got it.
Where you may hear MODY.
That's what we want to clarify that.
Yes. And so that is where you actually have a genetic mutation, which causes diabetes.
Right. And your diet and exercise won't reverse that.
It's not going to reverse that.
But you still need to change your diet and increase your physical activity to help control the diabetes.
Yes. Now, how is diabetes treated?
Yes.
So sometimes you can go, your doctor may say, focus on diet and exercise, and then we can try to bring these numbers down. Now, but then there's also where medications are oftentimes indicated. And that could be medications by mouth, pills. It could be injectable medications. Not every injectable medication is an insulin. And then, of course, there's insulin. And so diabetes, again, it has to be managed. Like, there's no getting away from it. Once you have a diagnosis, it has to be managed. And so those are a variety of ways that can be managed. Have a conversation with your physician and come up with a plan that is comparable for your diabetes, the level of diabetes that you have. And please do follow the plan.
So, Dr. Wardlow, let's go over glucose monitoring because there was a game changer a couple years ago with glucose monitoring.
Yes.
Can you go over that?
So, typically many people monitor their glucose by doing the finger stick. So, you have to stick your finger and put it on the test strip and put the test strip into the glucose monitor.
Yes.
Yep. And then get your reading. So now we have something new that's available. It's called the continuous glucose monitor, where you use a sensor. You put the sensor on your, just put it on a place on your body where
It's going to be able to measure.
Yes. And so many times people will put it like on the back of their arm because it's easy for them to use their monitor. And so what that does is it checks your sugar levels or your glucose levels in the interstitial fluids, which are the fluids around the cells. And so I will show you an example of a glucose monitor.
And just to be clear, the glucose monitor, you're not injecting yourself.
No.
As you were doing with your finger.
So it's a continuous glucose monitor where you have a sensor that you put on your arm, and I'll show you how to do that. And then you use the monitor. Now the monitor, you have to go where you have to set up your monitor to actually, what language you're going to use, and it'll go over the instructions for the monitor. It also allows you to put alarms for low blood glucose readings, as well as high blood glucose readings. Your doctor will program this together. So you program it together, and you and your doctor will determine that. And then, so you have this device here. And so what I'm going to do is I put the device on my arm, all right? And then you just hold it down. Voila, there's a sensor. Now, what's on inside of here? The way we introduce the sensor, yes, there's a small needle that introduces the sensor.
It's a small needle.
Yes, but the needle does not stay in your arm. Only the sensor is in your arm. The needle has retracted back into this device here. So you're not walking around with a needle in your arm. Many of my patients are concerned that, why do I have to walk around with that needle in my arm? No, you don't have to do that. And then, so then you have your monitor. And when you wave your monitor across your sensor, it gives you a reading in real time. Now, this monitor, the sensor is measuring the sugars in the interstitial fluid.
This outside the cell.
Yeah, right around the cells. That the sugars reach the blood first. So patients will notice that if they do a finger stick, the finger stick may be a little bit
Higher.
yes, because of the lag time before the sugar gets to the interstitial fluids. So it doesn't mean that your machine is inaccurate, that either of the machines are inaccurate, but it just means that one is measuring the blood direct, yes, and one is measuring the interstitial fluids. This is a game changer because it makes it much easier for patients to monitor their blood sugars. You can check your blood sugar and determine, you know what, I'm not going to eat that because my sugars are already elevated. Or you can check it and your blood sugars are a little low because low blood sugars are just as problematic as high blood sugars. And so this right here allows you to be able to monitor your sugars in real time, not have, a bunch of needles and test strips. And so again, game changer, continuous glucose monitor, have a conversation with your physician about it. Again, allows us to monitor the sugars in real time and be able to make better decisions when we need to as well.
Yes. Now, Dr. Wardlaw, before we wrap up, we have to talk about one more topic when we talk about diabetes.
Yes.
There are some new medications that are on the market that were originally used for diabetes, but we also started to notice some other effects of the medicine that led to weight loss.
Yes.
So can you please go over these medications?
We have new medications that not only control our blood sugars, we have the added benefit of lowering,
Managing our weight.
managing our weight. And so I'll show two examples here. So you have one medication, which I'm sure everybody is familiar with. They're called GLP-1 agonist medications, right? And you may know them as Ozempic, Wegovy, Mounjaro, Zepbound, and there are some others as well. There is Rybelsus, which is a PO form of it. There's also Trulicity. So these are medications that have been
Ozempic and Wegovy were initially marketed for diabetic control.
yes,
But now we have that added benefit. Not only is it managing our blood sugars, it is leading to weight loss.
yes. And so what happens is the medications, one, it helps to increase insulin. We know that insulin helps to lower the blood sugars. Two, it also helps to decrease your appetite. It also helps to slow how the food is passed through your GI tract. And so it makes you feel full faster. And it also makes you feel full longer. So then that decreases the amount of calories that you're taking in. And so that, again, has a positive impact on weight. And so you have these medications that are available. Unfortunately, we always have the access issue. Not everybody is able to get the medications, but particularly for diabetes, we have Ozempic and we also have Mounjaro. And they are weekly injections. And the medications can have side effects. It can have, GI side effects, abdominal pain, bloating, changes in your bowel habits. It can also cause some headaches. It can also cause dizziness. The medications are given in a titration fashion where we increase the medication over a period of time. So you start at a low dose and then end up at a maintenance dose. And then, so with the medications, again, injectables once a week. Your doctor is managing you, following you, making sure that you're responding to these medications appropriately. Also, there are some patients who should not have this medication, people who have thyroid medullary cancer or who have that in their family, people who have multiple endocrine neoplasm or a men condition should not have this medication.
So what Dr. Warlaw is saying is, as we always say, what's good for the goose is not always good for the gander. So just because your friend is taking it doesn't mean that you should be taking it. You should have a discussion with your doctor about these medications.
Yes, if you are already having significant issues with your GI tract, yeah, that may be an indication that this medication isn't for you. So please have a conversation with your physician. There are many people getting this medication online. I suggest that you do not do that. You have to be very careful. You have to make sure that this medication is being monitored. You have to make sure that your labs are being monitored. You have to make sure that it is an appropriate medication for you. And you have to make sure that you're getting the actual medication. Some of these online medications don't even have the active ingredients in it.
Exactly.
So again, game changer, not for everybody. Have a conversation with your physician. Not only does it help lower your blood sugars, but it also helps to lower weight. We know that obesity is a major risk factor
That
for
leads to other chronic conditions.
yes, and we know it's a major risk factor for diabetes. So
Yes.
drop that weight also helps with the diabetes management as well, and hopefully you can come off the medicines.
One other question. When you stop that medication,
Yep.
what happens?
Well, the people who have the most effective response to this medication is those who make sure they are exercising and are monitoring and modifying their diet as well. Because yes, the medication will work, but once you come off of these medications, if you have not made those adjustments, the weight is going to come back. So this does not replace diet and exercise, and is usually not the first line medication that we use to treat diabetes. We usually have you on an oral medication prior to that and look to see if you respond to that. If you're having side effects of medications, if your hemoglobin A1C isn't responding, your blood sugars aren't responding, and then your doctor may consider this as the next step. But this usually is not the first step for treating diabetes.
Again, conversation with your physician.
Yes.
So we have covered a lot with diabetes. So thank you for joining us, and tune into our next episode.